It is very important to understand that rheumatoid arthritis is not simply a joint disease, but really is a systemic disease that can affect many organs and systems of the body. In fact, many patients believe that this ought to be called rheumatoid disease, emphasizing its systemic nature. First of all, the eyes can be affected with a variety of types of inflammatory eye conditions. For example, the whites of the eye, called the sclera, can be involved with inflammation called scleritis, and that can be vision-threatening. Additionally, the cornea can be involved and damaged by this inflammation, leading to a condition called corneal melt, which also can jeopardize a patient's sight. Additionally, rheumatoid arthritis can be complicated by the development of a condition known as secondary Sjogren syndrome, which is really another autoimmune condition affecting the glands of the eyes, leading to damage to the tear-producing glands, decreased tear production, and finally chronic dryness of the eyes that can be a very persistent and difficult to treat problem. Next, the lungs can be a target of inflammation in this condition. And there are a variety of different types of lung disease that can occur in patients who have rheumatoid arthritis. First of all, the tissue of the lungs can be affected with inflammation, and this is known as interstitial lung disease, which can lead to chronic scarring of the lungs, loss of the ability of the lungs to exchange oxygen and carbon dioxide, and finally, threatening a patient's survival. There can also be obstruction in the flow of air in the lungs, which is called obstructive lung disease, and this also can be another complication of rheumatoid arthritis. There also is another complication which is called rheumatoid vasculitis, or inflammation of arteries and veins. And this condition, although becoming increasingly rare, can be a profound cause of disability and increased mortality in patients with this condition. It tends to cause a variety of things like skin ulcers, damage to nerves, and as I said, unfortunately causes a number of patients to die prematurely. There are a variety of types of heart disease that occur in patients who have rheumatoid arthritis. The lining of the heart, called the pericardium, can be involved. That is called pericarditis. It can also lead to inflammation of the muscle of the heart, called myocarditis. And each of these conditions often need to be treated with high doses of corticosteroids for alleviation of this inflammation. There also are a number of other manifestations in terms of other organs. The kidneys can be affected by a variety of types of inflammation, leading to some various types of chronic kidney disease. In addition, sometimes the treatments that we have for rheumatoid arthritis lead to various complications. The use of corticosteroids leads to a higher risk of infections, including bacterial infections, fungal infections, viral infections, and this is an important complication that can occur. In addition, both the underlying disease as well as the use of corticosteroids raises the risk of osteoporosis and ultimately bone fractures. And this is a major source of morbidity in patients who have rheumatoid arthritis.